The World Health Organization defines infertility as a disease of the reproductive system, defined by failure to achieve a clinical pregnancy after 12 months of regular unprotected intercourse and where there is no other reason delaying conception, such as breastfeeding. To be clear, there is primary infertility, that's in a couple who have never had a child, and there is secondary infertility, which is failure to conceive following a previous pregnancy. Experts say infertility may be caused by infection in the man or woman, but often there is no obvious underlying cause. But reproduction is such a large aspect of life for many cultures, and the consequences of infertility are many. These include personal suffering and societal repercussions in the forms of distress, loss of control, and sadly, stigmatization. Advances in assisted reproductive technologies can offer hope to many couples where treatment is available and when they can afford it. Professor Oladapo Ashiru is a reproductive medicine expert and is credited, along with Professor Osatogiwa Osagi, as having pioneered the IVF program in Nigeria and successfully delivering the first test tube baby in Africa in 1989. Professor Ashiru joins me on View from the Top today, and I want to thank him very much. Thank you, Professor Ashiru, for joining us.
Thank you. It's a pleasure to be here with you.
And thank you for tuning in. My name is Modile Sharafa Yusuf. Here is a brief biography of my guest before our conversation. Born on 3rd November 1950, Oladapo Ashiru obtained his MBBS from the University of Lagos and his MS and PhD from the University of Nebraska. He was appointed consultant reproductive endocrinologist at the Lagos University Teaching Hospital in 1980 and professor of anatomy in 1983, making him the youngest appointed professor in Nigeria at the age of 32. He was Dean of Basic Medical Sciences and later Deputy Provost of the Unilag College of Medicine in 1994. Professor Ashiru obtained the licentiate of the American Board of Bioanalysis in High Complexity Laboratory Director in 1997 and obtained a joint appointment with the Departments of Anatomy and Obstetrics and Gynecology at the University of Illinois at Chicago at professorial level. Professor Ashiru is the Chief Medical Director, Medical Arts Center and MART Medicare, and was awarded the National Honor Officer of the Federal Republic. Professor Ashiru, I am intrigued by that WHO definition of infertility, and so I want to start by asking you, is infertility a disease or a condition?
Today, we've recognized infertility as a disease. And in order to destigmatize infertility, in order to make it known to the public, to the world over, that it is not something that is caused by a myth, by other problems. It's a disease just like diabetes, like hypertension. Therefore, it's easier for us to get used with it once it's at that level.
What have you found to be the most common cause of infertility, and are there environmental factors that affect fertility?
Infertility is caused almost 45% by the female, another 45% by the male. So there are causes of infertility in the male, just as there are causes in the female. And then the rest are what we call combined causes. As of today, virtually most of the causes that we think were unknown are now known. And some of them are such as things you just alluded to, environmental causes. Those causes in the environment were not known before, and they are now manifesting with more tools to diagnose and recognize them. But the first cause for infertility is infection. Infection referring to sexually transmitted diseases. And this can occur to affect both the male and the female. In the male, these infections affect them in order to reduce the sperm population as well as to reduce the passage of the sperm. And in the female, it causes blocked fallopian tube, which causes permanent damage. Some of the bacteria that have been identified in this case are gonorrhea, which is very popular in terms of well-known. There are two other bacteria that can cause damage in the female and in the male. They're called chlamydia infection and trichomonas infection. Chlamydia is the silent infertility bacteria. Why? Because it shows no sign, and it's been shown to be the commonest cause of miscarriages, ectopic pregnancies, and of infertility. So as a general rule, in most IVF centers, you must make sure that you check for chlamydia and you treat it or do a prophylactic treatment for chlamydia. So there are other causes like syphilis, tuberculosis, and other things like that. Next to infection is the hormone imbalance, which causes inability to ovulate in the female. And some of these hormones are related to stress, causing high prolactin hormone and preventing ovulation. And in the male, the same hormones can lead to low sperm count. And sometimes, very, very important, it may not be due to sexually transmitted infection. It may be due to previous surgery. A lady at the age of 18 or 16 who has appendix removes the appendix. From removal of the appendix, there could be adhesions in the stomach, in the intestine, in the abdomen, which can cause obstruction to the tubes. So that inability to have baby because of obstruction of the tube is not due to being promiscuous, but just because of abdominal adhesions from removal of an appendix. Also, high fever like malaria, uncontrolled, can lead to adhesions in the abdomen. Some people have been known to have these adhesions because of high fever. And so if they present later on in life with tuber blockage, it has nothing to do with their sexual activities.
At what age does the female fertility peak, and when does it start to diminish?
The first one is that if you've been married for 12 months and you are under 25 years of age, then you will need to consult a doctor because there is a problem with infertility. The second addition to that is that if you are above 30 years, like 30, 35, and you are just married, then you cannot afford to wait for 12 months. 3 to 6 months is what you need to wait for, because there is a cut line in terms of the reproductive capacity of the female decreases, and as you approach 35, 36, it's going down. So you need to address the issue quickly.
How long should a couple wait before seeking treatment?
A newly married couple in their 20s, from my own estimation, in Africa, in Nigeria, 9 months is good enough. In fact, if you have been married, you should begin to access those basic information on how to get pregnant, that is on wanting a baby, to know the time that you are ovulating and the right things you need to do in terms of precautions and the various healthy techniques you must observe as a male or as a female.
And how long after that before considering something as drastic as the IVF option?
Today we classify that into two major groups. If a lady that's about 25 years old, 26 years old, comes to an infertility clinic asking for, he could go even to a doctor, and she attempts, or they attempt to conceive on 2, 3, or 4 occasions without any result. If they go to an IVF clinic, they will they will evaluate their various parameters. In most cases, as I told you, about 45–50% of the causes are in the male. If the sperm is not there or is low, there is no way conception can occur through sexual intercourse. It must be assisted, in which case the sperm has to be taken and injected directly into the woman's womb. And so, if a woman tries with a doctor to conceive for 3 months without any result, then that couple requires an aggressive intervention from an expert in IVF or assisted reproductive technology.
As you just said, there's this general notion that reproductive health is a women's issue. But researchers like you tell us that the reason for infertility could very well be the man's. How can we alleviate the disproportionate suffering and the burden imposed on women?
The only way we can do this is through constant, repeated media education and awareness. It's such a problem that it is recognized by the United Nations, by the WHO, and in fact, a number of pharmaceutical foundations are coming to the aid of this, especially in Africa. In one country in Africa, a woman was amputated in the hand by her husband simply because she has not been able to get pregnant within the past 2 years. And when the analysis was done, it was the man that had no sperm. Another example of a man who now showed up with his wife at the clinic, and he had low sperm, and he was able to be treated, and they were able to have their baby. And he came up to say that it is important for men to accompany their wife. In my own experience, when patients come to this clinic and they come as a couple, the chances of conception is faster, almost double, than if it's just the wife alone that comes, because you're able to address and solve the issue together.